Doctor, what are the benefits of a hip replacement? There are several. What are they? Hip replacement relieves pain and restores good joint movement in time of 1 out of 10 people. And the artificial hip usually lasts how long? 10 to 15 years. Before it needs to be replaced, doctor, new designs, materials, and techniques need to be in the replacement joints. Is that correct? Well, if it is lasting longer, maintaining a sensible level of activity and a healthy weight helps the joint last longer, too. Doctor, as well as the general risks associated with surgery and general anesthesia? Yes, a total hip replacement carries the risk of complications. Such as what, doctor? Such as infection and deep vein blood clots. And doctor, with newer procedures, however, pain is reduced, is it? Yes, the risk of a blood clot is lessened because less time is spent lying in bed. Doctor, the risk of picking up a wound infection in hospital is what? It is also less due to returning home more quickly. Doctor, occasionally the joint becomes dislocated when the head of the femur comes out of the socket. Yes, this is most likely to happen if you have revision surgery or replacement of an old artificial hip. Doctor, sometimes the leg is slightly longer or shorter than before, so you need to wear a raised shoe, do you not? Only at the shorter side. And are there any alternatives to this? Well, there are alternatives to hip replacement, but the hip pain and mobility may be improved with physical aids such as walking sticks, crutches, physiotherapy, exercises, and analgesic medicines such as acetaminophen and or non-steroidal anti-inflammatory drugs. Doctor, the hip resurfacing arthroplasty can replace the damaged surfaces of the femoral head. Is that correct? That is correct. Less bone is removed than with a mediastinal hip replacement. Doctor, the hip joint can also be fused, yes it can, to do what? To lock the bones into place. And it is a matter of stabilizing the joint and relieving pain, is that so? Well, the procedures are only performed on a weight-bearing joint such as the hip where replacement is not suitable. Doctor, for example, because of poor bone quality, would you say? Yes, compound osteoporosis or abnormal anatomy from a congenital dislocation of the hip, a deformed fracture, or where previous joint replacement or displacement has failed. Doctor, what can you do to prepare for an operation? Well, the patient can do a lot. What can the patient do? Try to be as fit and healthy as possible before the operation and lose some excess weight if possible. Stop smoking if possible. Doctor, what if I don't have the operation? If you don't have the operation, it is likely that pain and immobilization will slowly get worse. And what happens, doctor, during the recovery period? You may have a special pillow placed between your legs to hold the new hip joint still and help prevent dislocation. Doctor, may you have a compression pump attached to your lower legs, which inflates intermittently? Yes, and it encourages blood flow and reduces the risk of a blood clot. Doctor, DVT, or deep vein thrombosis, is what? That is a compression stocking which is usually fitted on the leg that was not operated on, and you may receive injections of an anti-clotting medicine called heparin. Doctor, physiotherapy usually starts the day after surgery, is that correct? That is correct. A regular daily exercise which is vital for a rapid recovery.
That's fine.